Medicine is an evolving field, and I'm sure you've seen for yourself, you've been here longer than any of us, and you've seen things change from the 90s, the 80s, the 90s, and now. What do you think are some of the things that you are excited about in medicine that might be the future of medicine? We hear a lot about AI in the field of surgery. We hear a lot about robotic surgery. What do you think, and what is your vision of what is coming up, and what do you think would be out the field of medicine, and in particular orthopedics, look like in the next several years, maybe 20, 30, 40, 50 years from now?
Mm-hmm. Yes, thank you very much. I think medicine is evolving very fast at the moment. Long ago, it would take a long time for a procedure for medicine to change. Okay, you would find probably, let's say a surgery, laparotomy. You would find you are taught, your students you teach the same thing, like that. But nowadays, medicine is evolving very, very fast because of these the new technologies, the AI technology. In orthopedic surgery, right now the AI has taken over most of the things that are going on in the field of orthopedics. If I take, for example, the issue of implants, nowadays we are doing custom-made implants, because long ago we used to have one size fits all. Like, for example, if it is let's say implants for the hip, for the total hip, we adjust the different sizes. But nowadays we are able to actually custom made. Like, for example, if a patient has needs a total hip, you can actually go and have a CT scan, and then they take that CT scan and do, using 3D printing, actually make implants that are specifically for you. And that produces better results, because if you have something which is matching your anatomy, you tend to recover better and have better results. So the 3D printing is something which has really come up. Or in case you have a very bad fracture, like fracture which is in many pieces, for example, they are able to actually do, with the help of the CT scan, they are able to make implants that can actually tailor to that. Yes. So we are getting more patient-specific kind of implants. And that is very good, because people have different shapes. We are not all the same. Or sometimes when you are doing revision, because of the wear and things that have taken place in the body, the anatomy is not normal. So nowadays we are able to actually do 3D printing, and you can get specific implants. Another area which has also developed a lot in orthopedics is nowadays we have absorbable implants, bioabsorbable implants. So, for example, if a small child has a fracture in a sensitive area, we can use implants which dissolve in the body. Mm-hmm. So we can fix the fracture, and then over time, those implants dissolve. Okay, and as the child is growing, the implants actually dissolve. It's not like before, where if you have an implant somewhere, you have to come for a second operation to remove it. But now, bioabsorbable implants are also developing. And then, of course, other things that have taken place now is using AI, to do procedures. We have nowadays, let's say if you are doing total joint replacement, we are able to do proper CT scans, and part of the procedure is automated. Yeah. So like long ago, I would have to do all the cuttings and all that. But with this new technology, once we have identified, once we have done your CT scan, we are able actually to put that program into a machine, and we just open, and the machine can actually do some of the cuts in the joint, and that is very precise. So you find the patient actually gets better outcome than when it's done manually. So these automated surgeries, 3D printing of implants, is really coming a long way. Yeah. The other area which is now interesting and I think is something which is worth noting is in the area of oncology. In the area of oncology. Oncology, first of all, the medical treatment has really saved many people. Long ago, if you had cancer, it's like you are forgotten. You know you are going to die. But nowadays, we have so many survivors of cancer because of the medication that is now available. And in surgery, surgery has even improved. Before that, if you had cancer of a limb, we had to do amputation. Nowadays, if you have cancer of a limb and you come to hospital early, we do limb sparing surgery. We are able to remove that particular section and we use an implant to fill up that part. And the patient is able to walk again and the cancer is gone. So in oncology also there's a lot of development. And of course in future we are going to see even much more development. Yeah, we can actually replace the whole femur. If your femur is shattered or is infected or is having cancer, it can actually be removed and we put an artificial femur. So, and you'll not tell, somebody will just walk normally, but actually the femur is an artificial one inside. So there's a lot of development which is going on. Yeah, and things are now more rapid. What you have this year, next year is something else. Yeah, so I think medicine is going the right direction. The only challenge that we are going to have, of course, is the finances. For us here, we just have to, just follow what the Western world is doing because we cannot afford all this research. And even all these new technologies, they are expensive. In St. Luke's here, we have done a limb salvage surgery. We have had a patient who had osteosarcoma of the femur. We are able actually to catch it early on time. So normally what we do, those ones is they start with the cytotoxics for like 2 weeks. Then they come, we excise that tumor. And then after that, they continue cytotoxics for the remaining 6 weeks. And that boy recovered. He's now I think he's even finished his secondary school now. Yes. So limb salvage is something that is coming and is doing very well. Yeah, thank you.
Is there room for robotic surgery in orthopedics?
Yes, yes. So robotic surgery, like what I was telling you about when you're doing a knee replacement, that's actually, it's a kind of robotic surgery. So the picture of the part you're going to do surgery is put into a computer in the machine, in the robot. And so you as a surgeon, yours is just to expose. Okay, so you just expose the bone. And that program that you have put into that machine now takes over. So if it is to divide the bone, if it is to remove a bit of bone, if it is to align something, it does that. Yes. So robotic surgery is now in orthopedics. In fact, I was telling somebody, in the next few years, I actually don't have to go to theater. You just sit in your computer, and the patient is being operated by the robot in theater. Yes, because in that robotic surgery, the one we have now, all yours is just to expose, and then the machine actually does the cuts for you. Yes, so you don't have to use the saw like we used to do. So maybe in future we even expose and do the surgery. Maybe who knows? So it's possible. Yes.